Thrombocytopenia, as the researchers explain, is a common laboratory finding in small animals characterized by a lower than normal number of platelets in the blood. This condition can be concerning as it may predispose animals to potentially life-threatening hemorrhage or spontaneous bleeding, particularly during surgical procedures. The process of determining the underlying cause of thrombocytopenia can be complex. Veterinarians typically consider a combination of the animal's history, clinical signs, and various blood tests, including the measurement of different platelet parameters. Sometimes, additional diagnostic tests like clotting times, serological tests, biomolecular tests, and imaging procedures are necessary to reach a definitive diagnosis. One factor that can complicate the interpretation of platelet counts is the occurrence of platelet clumping. This clumping can be due to improper blood collection or mixing of the sample with the anticoagulant ethylenediamine tetrashic acid, leading to a false decrease in the platelet count, a phenomenon known as pseudothrombocytopenia. It is crucial to identify this artifact by carefully examining blood smears for the presence of platelet aggregates. Once true thrombocytopenia is confirmed, it is generally classified into two categories: central thrombocytopenia and peripheral thrombocytopenia. Central thrombocytopenia arises from the bone marrow's inability to produce a sufficient number of platelets. This can be due to various factors such as cancer, infectious agents, hormonal imbalances, toxins, radiation, or certain medications. On the other hand, peripheral thrombocytopenia results from an increased consumption, destruction, or sequestration of platelets in the body, often seen in conditions like immune-mediated thrombocytopenia or spleen-related issues. The differentiation between these two categories traditionally required an assessment of the number of megakaryocytes, the platelet precursor cells, in a bone marrow aspirate or biopsy. However, the researchers point out that bone marrow sampling is an expensive, time-consuming, and invasive procedure, and the interpretation of the results can vary depending on the pathologist's experience and the quality of the sample. Limitations. The study provides strong evidence for the clinical utility of the immature platelet fraction in the Sysmex XN 1000V for the differential diagnosis of thrombocytopenia in dogs and cats. The established species-specific cutoff values offer a valuable tool for veterinarians in distinguishing between central and peripheral causes of this common hematologic abnormality. The researchers reiterate the importance of always examining a blood smear to rule out pseudothrombocytopenia before interpreting the immature platelet fraction.